Thank you, Lawrence. I'm handing over to Venkatesh.
Thank you, Stuart. I'd just like to make a couple of observations that I think are key to our whole discussion on prioritizing and scaling up interventions. The first, and this is something that has come up in a lot of previous discussions, the fact that all agricultural or health system-based approaches or any other approaches need necessarily to be complementary and mutually reinforcing. And obviously the objective is that we come up with an optimal mix of several interventions. It's never going to be one intervention that ensure that immediate needs for all the nutrients are met across the entire population, but simultaneously provide for additional nutrients to those that need them at different stages in the life cycle. And so determining that optimal mix and phasing is really governed by the availability of what is proven today. We need something that policymakers need something that they can roll out today. And so we really need to work today with what is already proven and is ready for a large-scale rollout. The second point I wanted to make was that where food and nutrient intake is compromised by poverty or geographic access, strategies are obviously needed to address them immediately. And many countries have worked with social protection programs such as conditional cash transfers, and these have been shown to be very successful in many Latin American countries and other parts of the world to increase household spending on food, including nutrient-rich foods. And I think that's something that's useful for us to know. And where such programs do not exist or are insufficient to cover the gaps, obviously, like in emergency settings, food distribution programs may also be required. The third point I wanted to make was that today in many parts of the world, we all know that the diets of populations are dominated by cereals with inadequate intake of all the other value-added foods such as pulses or fruits and vegetables or animal or dairy products. And the nutrient content of cereals as they are currently grown and consumed today are definitely not able to adequately provide all the nutrients that are required. And that's one of the main reasons why we have large deficiencies in several parts of the world. And that underscores the importance immediately for either food fortification in the short run, and I hope that that will be slowly and progressively replaced by biofortification that can take care of these key nutrients through the cereals, because that's a fact of life that diets are dominated by cereal foods, and while we would love to move towards a much more diverse diet, that's not going to happen in the short term. And we also know that even with all nutrients being provided through foods in fairly reasonable quantities, the nutrient needs of the most vulnerable, specifically pregnant women and children in the critical 1,000 days of life, must be ensured through a combination of approaches that includes not only nutritious foods, but also supplements. And that's something that has to continue to the future. Even in the most industrialized countries, we have supplements being provided at that stage in the life cycle. The other point I wanted to make was that all efforts should be guided by effective advocacy and communication at all levels. And we are particularly struck by the fact that high-level political commitment, where it has come from the office of the president or the prime minister in many countries, has been key to ensure very successful nutrition outcomes. We've seen that in the last decade in countries like Brazil, Mexico, Thailand, and more recently in some of the African countries like Senegal and in Malawi, where nutrition sits in the office of the prime minister or the president. I think that makes a huge difference. And if that kind of priority can be given to nutrition in several of the countries, I think it could go a long way. And just in terms of sending a strong message to all line ministries that this is being handled from the top. Here I'd also like to underscore the need for a better communication and cooperation across all sectors, including across agriculture and health. And even within these sectors, whether it's agriculture alone or health alone, the priority for nutrition is still not strong enough, and that's something that needs work as well. I'd also like to make a pitch for the private sector, which Kevin raised. How can we channel the capacities and the resources of the private sector and the huge potential for good in a constructive and responsible manner. And I think as a rule of thumb, I think if someone did a survey of what proportion of the population can actually pay for their own meeting their own nutrition needs, I would guess, although I have not seen any systematic study, I would guess that 60 to 70% of, or a majority of the population in any country should be able to pay for its own nutrition needs. And so my proposal is that if governments could enable the private sector to play that role and address the needs of the majority of the population, the public sector could then focus its efforts and its resources on those really at the bottom who need real support to either purchase their foods or through social protection programs. So I'd like to close by saying that achieving impact on maternal and child nutrition, both in the short and long term, will require a broad and coordinated effort, and we've heard that several times earlier in this meeting. And I would also strongly push for a sun process type of approach that offers a comprehensive framework for global action. Thank you very much.
Thank you very much, Venkatesh. Handing over now to Jay.
Thanks very much, Stuart. And in 1994, when I went into government under President Mandela to become the Minister of Reconstruction and Development, we also had very noble intentions. And if noble intentions alone could deliver the better life we want, a world free of poverty, unemployment, of malnutrition and hunger, it would be a most wonderful gift we can give. But we live in the real world. And the question is, why are we all here? You know, we're here because we care. We have the science, the technology, we have the expertise, we have the intellectual capital in this room to solve our problems. Yet, decades after we started to discuss it, we still have 1 billion people who are chronically food insecure. We have 1 billion people that are micronutrient deficient, and we have 1 billion people that are obese. That's almost half of humanity. So what do we have? Not just a global problem, we have a global emergency. And we need to act according to that. You know, if I recollect what we did when we faced the issue of an AIDS epidemic, or we faced the issue of odious debt in Africa, or we faced an environmental crisis, what did we have? We had leadership from the top, but really what changed the game was the demand from the bottom. It was the pressure from the bottom. It was those millions of people, like in the streets of Cairo or in the streets of South Africa in the 80s, that demanded accountability. And I think if we look across us here, we have incredible intellectual content and talent here, but there's an element that is not fully represented. And those are the grassroots movements that really represent the people that we are trying to address. The women's organizations, the youth organizations, the student organizations. And I think that's what I want to talk about, theory of change. And, you know, because what do we know today? The system is broken. Today, the speculators that nearly brought the global economy to a crisis through speculation and profiteering are now setting up the Ponzi schemes for the food sector. And we have to recognize that. The question is, what do we do about that? And in a sense, you know, I can remember going into government, and I was from the trade union movement. And Mandela said to me, well, you've organized millions of people to go out and strike. Now can you find a way to work with all these sectors, including the private sector, that makes us deliver what we have promised our people in South Africa, a better life? And so I think the important thing that I want to make is that there's leadership from the top, which is fully represented here, but there's the demand and leadership from the ground that we need to build that value chain across. And so there is something systemically wrong with what we have to deal with in the food area. That food prices will continue to rise. In real terms, 50 to 100% over the next 40 years. That the population growth is going to reach 9 billion. And that no matter what we do to improve agricultural productivity, we're still going to have a problem. So we have to deal with the issue of waste. And we've addressed this as a critical part of the value chain. And we have to deal with the issue of water. 70% of water is spent in agriculture. Yet, You know, we know 50% is loss. We have to deal with Africa, where it's clear. But having the last tracts of arable land, there's a land grab taking place in Africa by countries from outside of Africa, when we have our own problems. So the critical issue, what's the delivery science that we need to do? What do we need to bring ideas, money, and the vision a la Swaminathan to look at that value chain? And I think that one of the things I've learned as the chair of GAIN is that we have to look at the PPP, as I call it, the politics, the people, and the partnership. And so the fact of the matter that we can today have built a model that delivers in over 25 countries new products that meet the needs of people close to 400 million people, that gives them access to new products, means we've got to understand how we build that coalition. What are the partners that have specific capabilities and understanding and of the different parts of this value chain, and how do we work across that value chain, and understanding the weaknesses and strengths of each partner. For example, this morning I heard that 4% of the agricultural technologies that we already have are being adopted at a grassroots level. How do we increase and scale that? And I think that the important thing is the model. How do we look at the model? How do we take the R&D that exists out here in companies, in universities, and the IFPRIs of this world? How do we look at innovative finance that is able to crowd in the type of finance that is required to be able to get these products and down to a level that is at a grassroots level? How do we look at M&E, monitoring and evaluation? You know, part of what we do at GAIN is that we use 10% of every project has to go to M&E. And critically, how do we build alignment between the different parts of the value chain? So I think the final point I want to make, the key discussion we should have here is about accountability. Accountability from our governments, accountability from the private sector, accountability from donors, and accountability from communities themselves to change social behavior so that we are building better nutrition that improves health of our next generation. Thank you.